Prepare for more time in lockdown, New Zealand. Modelling experts predict the Prime Minister will make it longer for everyone at 3 p.m. tomorrow. But Auckland and Coromandel could face 3 to 4 weeks at home. And here's why. 11 new cases today, taking our total to 21, all in Auckland and all Delta. There are more than 100 locations of interest. This bar in central Auckland is just one of them and was visited 3 times over 2 weekends. These pictures are from one of those nights. A big piece of the puzzle has been found. Most cases are linked to a returnee from New South Wales who did their managed isolation at the Crown Plaza. And more Kiwis will be protected. Parents can book their 12 to 15-year-old children to get a jab from tomorrow. Health correspondent Lucy Warhurst begins our coverage.
The queues for testing started early. This is Balmoral in Auckland. I'll keep that running to show you how long they are. And this is why so many people are lining up. The Prime Minister lined up the kick.
I know we're all prepared for cases to get worse before they get better.
The Director-General of Health knocked it home.
Today I can report there are 11 new positive cases of COVID-19 in the community.
A total of 21 Delta cases so far, all in quarantine. 12 definitely linked to the Auckland cluster, 8 still under investigation. One other isn't linked. It's an international airline crew member who flew back from Japan. But there's been a crucial breakthrough. Genome sequencing has confirmed the link to the New South Wales outbreak.
That our current positive cases are a close match to a recent returnee from Sydney.
They arrived on a managed red zone flight on August the 7th, almost 2 weeks ago. A day 1 test on the 8th came back positive on the 9th. They were transferred from managed isolation at the Crown Plaza to quarantine at Jet Park that same day. A week later, on the 16th, they became unwell and were taken to Middlemore Hospital.
Today we believe we have uncovered the piece of the puzzle we were looking for. And that means our ability to circle the virus, lock it down and stamp it out generally has greatly improved.
So we know how it likely got here. Now we need to find out how it got out.
We have to learn from these failures and make sure they don't happen again, or we minimise the chance of them happening again.
And there are 1 or 2 missing links. Testing is key and people are turning out in their droves. So it's not even 11 o'clock and the people at the front of the queue tell me they've been waiting 3 to 4 hours. The queue at St Luke's a kilometre long. This queue in Balmoral is even worse. The queue goes 1.5 kilometres in that direction, almost back to Mount Eden. Yes, the line of traffic I showed at the start is still going. Are you having fun?
We are.
How long have you been waiting?
About an hour and a half now.
Oh, sorry, you've got a bit to go.
Oh.
Good luck. For most, it was not fun.
So I woke up with a sore throat and a runny nose. And I work at a hospital, so...
Got a bit of a cold and flu symptom, so I thought I'd come and get checked.
How long have you been waiting?
Oh, almost 4 hours.
Just got a cough, so just wanting to make sure it's nothing serious.
These flatmates are linked to a location of interest, Auckland University of Technology.
Amelia was at AUT.
I was at AUT at the time.
Are you worried?
Yes, very worried.
Yeah.
I think it's just scary now, all of the different locations coming up.
And as the list grows, so too will the queues. Thousands were tested today, but many were turned away, only to try again tomorrow.
So, Lucy, why is the Crown Plaza such a crucial piece in the puzzle?
Well, this is an interesting development. 3 people staying at the Crown Plaza MIQ facility have now tested positive for COVID-19 on day 12 of their stay. Now, the Crown Plaza is where the Sydney case originally stayed, and these 3 were in the adjacent room. Now, all the people on the same floor are being stopped from leaving while they investigate to see if there's a link between the Sydney case and these 3. And with Delta, that's a risk.
Thanks very much for the update, Lucy.